Hello everyone. So here is Faranak Impact. Faranak Impact presents an interview today with Dr. Fereshteh Yazdani, who is a pediatrician, and she kindly accepted to be here with us today for an interview about the common questions that parents have about hearing and speech development and early interventions for little kids under 3. So today we will have a 20 minutes live interview on our Instagram, and we invite you to be with us for this amazing interview. If you have any questions, comments, anything you want, we can see your comments. Please feel free to ask us anything you want. You can type it in the comments and I can see them, and I will mention your questions from Dr. Fereshteh Yazdani, who is today with us. Thank you, everyone. So, Dr. Yazdani, could you please introduce yourself briefly and tell us about your experience, your everything you want.
Hello, everybody. I'm Dr. Fereshteh Yazdani. I'm a graduate from medical school, Faculty of Medicine, Tehran University. After a military service for 2 years, I had a residency at the Children's Hospital of Iran in Tehran. This center actually was and is a very big referral for all over the country, Iran, with very complicated patients. I finished residency, and after that, I was asked to stay as a faculty member. My job as a faculty member was not only seeing the patient, but also training and educating a medical student, pediatric residency. For the first time in Iran, subspecialty of pediatric immunology allergy was approved. I was the first one that registered and graduated as a pediatric immunology allergy, and I stayed in the same center with late Professor Dr. Farhudi, who was a well-known and actually well-known in even Canada in immunology allergy. There we had lots of experience with very, very uncommon and complicated children, still training medical student, intern, pediatric residency, fellowship for allergy immunology, and even PhD doctorate degree for immunology allergy. After a while, unfortunately, I decided to leave the country, while still I was a permanent employee of Tehran University. In Canada, actually it was banned for anybody to claim that as a doctor to work. Still, because of my huge passion for pediatric, I started studying the whole medicine from the beginning. And for the second time, I participated in the all examination in the United States and Canada, and then I was approved for a program, and because of assessment I had, I needed just 1 year of residency, which was done at the Sickett Hospital in Toronto, which is a leader in research and scientific, subject for kids in Canada, and one of the biggest in the whole world. After that, I had to work in Guelph for 10 years in a general hospital, and I was in charge for not only office-based patient, also admission for pediatric patient in pediatric department, handling babies from the time they were born, checking them in NICU, and then emergency patient. After 10 years, I decided to move to Toronto, and now I'm here, and I'm happy to serve lots of Iranian families with their precious babies and help them not only medical-wise, but as a support, because I know how stressful is this stage of life, having a baby with not knowing language and your mom is not beside you.
Okay. So today we are going to ask you some of the common questions that parents have about their babies, ear, hearing, and like speech and language development milestones. So the first question is, can frequent ear infections affect my child's hearing?
When we talk about ear, it has 3 sections. The first is outer ear or external ear, that it could have infection, which usually happens in older ages, very painful, and block the ear and causes hearing loss. But fortunately, this is temporary, and as soon as the infection is gone, hearing is back to normal. The internal ear, which consists the nerve, hearing nerve, is the one that is either is affected isolate alone by some infection, or as part of general infection in the brain, like meningitis or encephalitis. That means in general infection of the whole brain that could affect hearing center in the brain and also the nerve. In these cases, unfortunately, if hearing loss happens, it could be permanent. But fortunately, this kind of infection are not common. The common problem is infection of the middle ear, and we call it otitis media, and the most common reason for that are viruses, infection, and allergy. Any of these could cause a loss of hearing, but depends on the age of the baby, the symptom could be different. The younger the baby, the less specific symptom with the baby. For example, under 3 months, we don't label as a local infection in baby. Any baby with any fever should be considered as an infection of the blood and go to hospital. Under 1 year or 2 years, the baby could have fever, be nagging, cranky, not eating well, little bit of loose stool, little bit of vomiting, and then, of course, on the exam, eardrum could be red, or even it could have discharge. The older the baby or child gets, the symptoms are more localized to ear, and the common symptom are ear pain or touching or pulling the ear constantly, low hearing, that you notice that all of a sudden your kid doesn't answer when you call him, or a little bit of fever sometimes. Fortunately, if the reason for the hearing loss is treated well, the hearing loss is temporary. And one of the also common reason for hearing loss could be related to allergic rhinitis, because there is a connection between area of back of the nose pharynx to the ear, which is called eustachian tube. Any allergy, we have increased mucus, even if it is not infectious, plus swelling that could also block and close eustachian tube. As a result, the air in the middle ear is empty and filled just with air. Then the reduction of the air causes collection of fluid instead, and any fluid in the middle ear can cause a loss of hearing. And in this case, allergy should be checked and also treated.
Okay, thank you. So what if I suspect my child's hearing is not well?
As soon as you have the tiniest suspicion that your baby is not hearing, better to immediately see a doctor. Any doctor, family doctor, pediatrician, or even doctor of audiology. And a test should be done because hearing in low degree cannot be assessed by, assumption that parents sometimes say, no, hearing is normal. I say no. Low hearing is not assessed by parents, and they need for sure a hearing test to be done.
Okay. So how does hearing loss impact my child's speech and language?
Yeah, the most important factor, actually, speaking is not just speaking with tongue. It started with hearing first. Everything in the ear should be normal, and then messages through the hearing nerve goes to the hearing center in the brain. Then hearing center in the brain process the word that they need to be spoken and come back to language. So this hearing is the first station for talking. So if it is impaired, it is low or absent, for sure it affects how a baby or child can start talking and develop. And actually, speech development is so important in the developmental process, even if blindness is not also fun, but compared to a blind child and a deaf child, the deaf child has much more risk for developmental delay and social issue.
That's completely true, and thank you for your explanation. So what's the difference between temporary and permanent hearing loss?
Temporary, when we say, depends on the reason, because otitis usually media, the middle ear and external ear usually are most of the time infection, or even, for example, foreign body in the ear canal that could be removed. So the hearing loss because of them is temporary. But when it comes to the involvement of hearing nerve or brain center for hearing, that could happen after brain infection, that could damage the hearing forever and hearing loss be permanent. Even though if the baby develop hearing loss right after meningitis, over time they may get a little bit better, but always usually a residual hearing loss or low hearing stays for child.
Okay, thank you. So we all know that all children who are born here and everywhere, and they go for the screening, the early screening, hearing screening, and mostly the hearing screening is okay and they pass the exams. And if they not, they are referred to the related centers and doctors and etc. So we assume that my child is in the screening, everything was well and she was passed. When should the hearing be checked again if the newborn hearing was successful and everything was okay?
Usually if the child passes hearing test on the newborn screen, and if there is zero risk factor, and if caregiver or parent are not suspicious of the baby not hearing well, there's no need for repeating the hearing test. But if there is a tiniest risk factor, that risk factor could be a genetic disorder. If there is a member with low hearing in the family that is related through blood, not relative of marriage, relation. If mom got any infection during pregnancy, especially viruses like COVID, like anything, even if, or if the baby is born early, spend time in a special care nursery. If the baby weight is below 1.5 kilogram, if the baby develop jaundice, if the develop has any kind of risk factor like head trauma, meningitis, hearing test should be checked again around after 6 months of age again to prevent developmental damage that could cause this.
Thank you so much. So, is getting cold or teething affect hearing?
What?
Teething.
Oh yeah, teething, no, because as grandma said, teething could cause a mild sickness like light fever, crankiness, runny nose, but usually doesn't cause a hearing. And if the babies touch this way, usually mom are afraid that the baby has ear infection, but usually because the nerve is the same path that teething is, they feel pain, itching in the gum, so the baby tries to do that to get rid of that. So the answer is no. But about viral infection, it could cause temporarily a little bit of hearing loss because of a stuffy nose and air balance in the middle ear could cause a little bit of low hearing, which also is not permanent and goes away.
Okay, thank you. What are the early signs for hearing loss in babies and toddlers?
If the degree of hearing loss is low, it could not be noted even by parent or anybody until the baby should start normally talking and the parent notice that the baby is not talking well or has some problem. But for very young babies, like newborn baby, usually they startle like this by any loud noise. Over time, around 2 months of age, the baby reacts by smiling, and if you start talking with the baby loud and completely obvious movement of your lips, the baby tries to imitate you and moving lips, and over time, around 4 months, the baby usually has loud smiling, cooing, and later, maybe around 6-7 months, even turning back to her or his name. And actually, just being checked by a pediatrician or a doctor, but developmental wise, if development is normal, this is a security that the baby hearing is normal. But any suspicion of parent means hearing test and clearing and reassuring parent that the baby is fine.
Thank you so much. So today we had an interview with Dr. Fereshteh Yazdani, a very experienced and kind and dedicated pediatrician. Her office is on Shepherd and Young, Hallmark Center. If you want, you can Google her and go and see her if you have anything with your babies and any concerns. And if you have any questions, feel free to ask us. I can ask Dr. Yazdani your questions If not, we are going to the end of our life today. Faranak Impact has regularly live interviews on Instagram with professionals, with parents, with the youth who are deaf and hard of hearing, who inspired you with their journeys with hearing loss, and etc. If you are interested to be interviewed by us, just contact us and message us, send a message to us, and we are here for you. If not, try to enjoy our live Instagrams. And okay, so Dr. Yazdani, is there anything else we should talk about? If not, please say goodbye to our...
Just your babies are your precious possession in your world, and you are in charge of making a good future for them, which is not necessarily money. But when you have to make them a very healthy lifestyle, educate yourself more, because what you do today matters for your babies throughout their whole life. And the best to me is a healthy lifestyle, an educated mom, which is very precious for a baby. Thank you.
Thank you so much, and see you later. Bye for now.
Thank you.